We're now joined by Dr. Daniel Varga, who is Chief Physician Executive at Hackensack Meridian Health, a supporter of our healthcare programming. Dan, good to have you with us.
Good to be here with you, Steve.
Let's just confirm that you are not in New Jersey. Behind you, I'm looking at Amen Corner at the Masters, if I'm not mistaken, correct?
We can only hope, man. We can only hope. Been a long, cold winter.
Yeah, we're taping at the end of March. That looks really good. Hey, Dan, let's do this. You and I have had so many conversations around physician leadership. I coach in around communication leadership, your folks. But at the same time, one of the issues that keeps coming up is the question of vaccine resistance. Let's get this out of the way. Of the physicians around you, give me a conservative estimate of the number of physicians who have taken the vaccine and those who are still resistant.
Now, I'd say on the physician side, we're probably 85, 90% vaccinated. I mean, I think that the doctors who've had it available to them stepped right up. I think, you can look at the science, you can see the science, you can understand the nuance in the emergency use authorization. So I think the doctor uptake has been really, really high.
And beyond physicians, there are nurses, there are technicians, there are others, respiratory therapists. Do the numbers go down after that in terms of those willing to take the vaccine?
Yes, so if we look at our team members across HMH as an example, we're at about 60% vaccinated. That's a little better than the national average. National average is around 50%. Couple buckets of folks you have to keep in mind at the healthcare worker level. The first is we have a very diverse community of team members, and when you talk about physicians, nurses, physical therapists, pharmacists, environmental services workers, food service workers, patient care techs, they all have a different vaccine literacy, if you will, a different healthcare literacy, even though they're working in the healthcare field. And in some populations, particularly our populations of color, there is a historical resistance to vaccines in general, as you might expect. But at the same time, those are folks who are working in a healthcare environment. They're at risk, so you would like to make sure that those folks are as well protected as possible. And what we have found in this setting, with particularly that group, with disadvantaged groups who have an inherent suspicion of vaccines, is that the way we've been addressing that is one-on-one. I mean, trusted peer, respected team leader, a person of your demographic who is a physician, actually having one-on-one conversation with you. Found that to be far more powerful in terms of trying to overcome the resistance. It's that concept of meeting folks where they are.
Let me add something to that.
That's been very positive.
Thank you, Dan. Sorry for interrupting. Let me add something to that. Go onto our website. Our team will put it up in post-production, steveadubato.org. We did an interview with HMH CEO Bob Garrett together with Harry Carson, old school. Harry Carson, one of the greatest football players of all time, played for the New York Football Giants, all-pro, Super Bowl winner. That interview that I did with Bob Garrett and Harry Carson, who is African-American, who took the vaccine, who talks about the vaccine and its efficacy and its safety, check that interview out. It's one of many conversations, along with other healthcare professionals, that you need to listen to. Dan, let's do this. Some misconceptions that we deal with right now. Can we do that?
Yeah, sure. And and actually, it gets it that right out of the gate. It starts with a population in our healthcare workers that we're really concerned about, and that is women of childbearing years and women who are pregnant.
Take it on. What's real? What's make believe?
Steve, this issue is one issue that is a true clinical decision-making conundrum, and the other that is a situation where we have to overcome a lot of false information. The first issue is for a pregnant woman, because we didn't study the vaccine in its phase 1, 2, and 3 clinical trials in pregnant women. There isn't data on pregnant women right now and how it works, is it safe, et cetera, et cetera, et cetera. What we do know is that women who get COVID-19 while they're pregnant get really, really sick. And all of the major obstetrical organizations, American College of OBGYN, the reproductive endocrinology societies, et cetera, all of them had said, talk to your doctor about weighing the risks and benefits, but understand this, that it seems like the risks of getting COVID while you're sick, while you're pregnant, far outweigh the potential theoretical risks of vaccination.
Let me try a couple other misconceptions, Dan.
Yeah, then on the other side of the equation, you've got the big issue of will particularly the mRNA vaccines, the Pfizer and the Moderna vaccines affect your fertility? There is no data, none data to support that assertion. And again, many of the professional societies have come out strongly against that, or letting folks know that that is not a worry. And we, again, Steve, to using that kind of peer conversation, we have had our OB/GYN physician workforce out in force talking with folks in the hospital to make sure that they understand, I'm a pregnant woman who's an OB/GYN, and I'm going to take the vaccine.
Let me try this one. I will disclose that I, in fact, have had the Moderna vaccine, both shots, and feel very fortunate in that regard, and hope and pray that those who want the vaccine get access to the vaccine and get the vaccine as quickly as possible. So, misconceptions. With the variants out there, am I, quote, protected to the same degree, 90+% against those variants as compared to the original, if you will, COVID-19?
So I think one of the things we're learning—
And I'm not just talking about myself, I'm talking about millions of others in the same situation. Go ahead.
Yeah, I mean, I think, so what we're learning, and the data is not complete on this yet, is that what we believe we're seeing is that you will still, even though it's not completely protective, because remember the vaccines, the Pfizer and Moderna vaccines were tested largely against the wild coronavirus, so that we hadn't really seen the emergence of variants at that juncture. And both of them are 95% effective against preventing the acquisition of the virus. Then you saw the J&J vaccine come out. It actually got studied at a time when the variants were starting to come up. And it was more like 65, 70% effective against preventing you getting the virus. But remember, about all three vaccines were almost 100% at preventing death, serious illness, and hospitalization. What we're seeing in the situation we're in right now is that folks who've been vaccinated with the Pfizer and Moderna may well show up with positive tests somewhere down the line. And it may be related to a variant, but we believe there's still very significant protection against the three endpoints we're worried the most about: death, serious illness, and hospitalization.
By the way, check out Dan Varga on a regular basis and NJ Spotlight News, which is on NJ PBS, on WNET, public television stations in our region. He's on a regular basis offering insight and important information. Dr. Varga, thank you so much for joining us. We appreciate it.
My pleasure, Steve. Anytime.
At the Masters. Be right back after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Sharing Network, Summit Health, Horizon Blue Cross Blue Shield of New Jersey, NJM Insurance Group, the Healthcare Foundation of New Jersey, IBEW Local 102, the Fidelco Group, ADP, and by Fedway Associates, Inc. Promotional support provided by NJ.com and by the New Jersey Business and Industry Association.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.